Thanks everybody for coming, and thanks for letting me stand up in front of you. Nicole talked to me, I don't know, 6 weeks ago, and knew that I had a checkered past and have had several jobs, and thought that maybe talking particularly for the people who are wearing the blue coats that we all have a great deal of fondness for, might be interested in some of those decision-making aspects. So my goal is to kind of force all of us to think a little bit about the decisions we've made in life and what did we really use to make those decisions. And as I thought about it, I thought that would be really boring. So to try and avoid boredom, I'm going to try and have some 50% content, about 25% some context about where that content fits, and then just because it's going to be 25% emotional because I have such affection for this place, I'm going to try and follow Nicole's lead and not cry. So my disclaimers, I like to talk, so Mike and Nicole give me the, okay, that's enough signal if I get too far and too deep in it. I don't have any financial disclaimers, but I want to bring up some emotional disclaimers. My father died the year before I started my plastic surgery residency, and he was 51. In the old days, it was much more of a job interview rather than a mechanical computerized process. That is to say, there was no match, which has its sort of disadvantages, but it had some advantages too, because it was a very personal thing. You came, you met the faculty, and if you fell in love, you married, and if you didn't, then it was like, okay, good luck, keep going around. Yeah, I distinctly remember going out to some place for breakfast with Dr. Zook on a one-on-one interview. And he was about 4 years younger than my dad, so I did all those emotional, bad mental health transference things. And I think not only I, but I think a lot of us have taken to Dr. Zook as pretty much a father figure. Every time I stick local anesthesia in somebody, I remember this picture of where the parts of something even as simple and as elegant as how do you inject local came from somebody who paid attention to detail. And so that attention to detail was built in to what the training program was. Dr. Russell turned 40 while I was a resident. Just as another aside, I think we're all family, so you're going to find me extraordinarily blunt along the way about some of my personal failures, because I think if you can benefit from my personal failure, then maybe you won't make the same ones. I doubt it, but you might. So, and he was kind of like that older brother who helped me get into trouble and then helped me get out. And you saw, I was a part of that team that put Henry Abel's hand from one arm to the other arm on that New Year's Day. What didn't get told in that story was at the time, Biggerstaff and Bubba had a bar that was 2 blocks down the road. So after we spent all day operating, it was really nice to have a faculty member who provided all the tools of what you needed on a given work day. Doctors Neumeister and Sommer have, you've got 50 years of leadership here. And I don't know if it's a first, Mike, but I'm pretty sure there's not another program in the country that's had 50 years of the stability that this place has, both in terms of the quality of the teaching, the ethics that it has, the necessity and the manifestation of service with 2 leaders. You could have only had one, but Zook died. Otherwise, we'd all have Zook. Anyway, so I see them as sort of the watchful guide parents of my family. And Mike, I don't know if he still tells the joke anymore, but when the program closes, Mike's going to go down in flames, and maybe tomorrow you can tell. So I consider us all a family, and if I don't know you, and you trained here, and you need help, I got you. Come to Montana, we'll have a great time, even if you just need a place to hide out and cry. Okay, so I was born 68 years ago. I went to a rural high school in Kentucky. I was pretty much the nerd geek guy, got into medical school after 3 years. My dad was a general surgeon, and it was back in the old days when general surgery was really general surgery, where you did C-sections and hips, and the town of 1,200 people that I grew up in. So I learned medicine in the old days when it was real live medicine. You'll get to see this shirt tomorrow at the pool, but 25 years ago we did an event similar to this, and then we had 25 years of excellence, now we have 50 years of excellence. I was here for 2 years. It was a new culture for me in the plastic surgery community. Elof taught me a couple of things very early on. We were doing a scalp flap, and he very bluntly told me that I didn't know how to sew, and he was right. In general surgery, it was kind of like if you stay together, that's all it takes, and in plastic surgery, it's a little more than that. He also taught me there was a hierarchy. One day he had his secretary page me to call her, to talk to him, for him to tell me to call the floor, to phone in a verbal order. I got the message right away. I did get the resident teaching award for the 2 years I was here, and I was very proud of that, and I learned that I really enjoyed the teaching aspect, that trying to use all of the faculty's example to reach into the future to create the next generation of plastic surgeons. Dr. Zook offered me a job. I accepted. I was having an affair, and that got discovered enough that he said, I can't keep you on the faculty. And just as the perfect parent, I dealt with the consequences. He gave me the consequences of my poor behavior, but he wasn't abandoned. And I think that's another part of what Dr. Zook's part is. He always did the right thing. You may not always like what the right thing was, but he always did the right thing. So I interviewed when my daughter was 1 day old. I went to Ohio State. Bob Ruberg at the time was the chief. He had no other faculty, so it was easy to know what my job was. If Bob wasn't doing it and it needed to get done, it was my job to do it. But I rapidly became aware of the excellence of my training. I started in August, and in September, when I had my birthday, I got called from the ER from one of the residents who said, I don't know what to do. I have a patient here he's a prisoner. He got stabbed. He got stabbed in the arm. He got stabbed in the chest. He needs a chest tube. He needs his nerves fixed. He needs his artery fixed. And vascular doesn't want to do it because there's a nerve injury. And general doesn't want to do it because there's an artery injury. I said, I know how to take care of all those problems. Let's go to the OR and fix them. So we did. And the next day I went to my boss and I learned a valuable lesson about there's two kinds of complaints to have, because I thought that was pretty weird. And the two kinds of complaints are, here's a complaint and here's my plausible solution to the complaint. Or here's a complaint and I don't see a solution, but I really need to vent. And that's been a good practice of mine in marriage and relationships, to sort of go, I know you're my superior, I know you can't fix it, but it doesn't make it right that it's there and you should be aware of it. So I was at Ohio State for almost 20 years. When they were getting ready to ask me to be the chief, I said, to Dr. Russell's point, we don't know any medicine. I know medicine, I don't know business. And you're asking me fundamentally to run a small business. So I negotiated that I put in a third, the division put in a third, the department put in a third, and I went to Auburn and got my MBA. Hugely fun learning about stuff that had nothing to do with medicine. It was a very different way to think. So I got that education, and as I came back, they said, do you still want the job of being the chief? I said, well, yeah, I think so. And they said, well, by the way, you're $300,000 in debt. The old chief is going to stay on and keep his salary. And you still want the job? I thought, oh, okay, because we're all kind of baked in egotists. And so in 18 months, I got the faculty to take a pay cut. I got the Children's Hospital to pay for a salary. We turned our budget around and had a projected $70,000 surplus for the next budget. I said to the department chair, I need to give back my faculty what I took away from them. We did what you asked. And he said, nah, I don't think so. I like this the way it is. So I learned that just because you're doing the right thing and just because you get a good outcome doesn't always mean you're going to get valued for what you think it is. So I had the decision then about, do I change jobs? And I came to the conclusion one night when I came home that there wasn't anything they were going to offer me that was going to make me willing to stay. Because it wasn't a thing, it wasn't dollars. It was still my resentment, because if you haven't already experienced this, one of the worst things that you can feel is to be held responsible without being given the authority. I was responsible for plastic surgery, but I wasn't given the authority to manage my staff the way that I thought they needed to be managed. So I left. And if I ask myself in retrospect, what was the best thing I did for Ohio State plastic surgery over the 20 years that I was there? Was I left. Because it created a vacuum that made the administration, instead of Brent being a guy who's never going to go away, Brent was gone and there was this vacuum. And so they had to go out and recruit somebody against the market about what that was. And that allowed Ohio State to actually change to what it is much more now. It got departmental status, it got more faculty, it got more money, it got more internal respect. So even though our egos tell us, I can fix that problem, sometimes getting out of the way is a way to help get other people to help fix the problem too. So we moved to Montana in 2006. I opened a private practice, and in 2008, it was a bad idea to try and open a private practice in Montana. So after 2 years, it was like, okay, I've got plenty of skills and no work. So this, again, is as you're going through your life, if you can construct some contingencies for yourself, you may not need them, but it's nice to have them. So one of the accidentally smartest things I ever did was work with the hospital, and we developed a wound center. And if you think about wounds in the future, it's not going out of business. People get holes in their skin. We're getting older. We've got more diabetics. So then in 2015, the hospital came to me and said, we want to hire you as a plastic surgeon. And I said, no, but my wife's health was failing. And I said, but I'll do this. I'll be full-time in your wound center, and I'll still take facial trauma call, because nobody liked taking facial trauma call. But so it was a good decision to change, not because I was unhappy doing what I was doing, but because I now had an exit strategy to how to get out of private practice to help take care of my wife. So the same way I took care of Ohio State by leaving, I took care of my wife by getting more time and more stability by having a job, which is not as much fun as operating on people. It's just not. But it's a safe job, it gave me money, and it gave me time. So on the personal side, I was divorced twice, married 3 times. Those are, ends up in the good thing. I have a granddaughter, and my wife and I got married in 2001. And you have to, when you go home at the end of the day, you should always stop and sort of go, I can easily list the bad stuff, but you got to pause and think about the good stuff. And over my time, I've had lots of good stuff. I was walking through the airport. I was on the moving runway in Salt Lake on my birthday in 2016, and got suddenly short of breath. And like every good doctor, I ignored it, even though I told my wife, I said, I'm either having a heart attack, a pulmonary embolus, or something else bad. If you ever have a patient who's short of breath, respect them, because man, is it miserable being short of breath. Miserable. So I had clots in both lungs. It did take me 3 days to realize I wasn't going to get better on my own. And everybody who came to see me in the ICU said, I violated HIPAA, I looked at your lungs, you should be dead. There's not a good social response back to, you should be dead. Thank you, or I'm sorry to disappoint you, or... and my wife died 3 years ago. And so sometimes you get it wrong a couple times, you get it right. So we were married almost 20 years. I don't know if you can see the cartoon, but that's the relationship that we had. where the woman awakens the guy who's napping on the beach when the younger girl goes by and he says, "Thank you, my dear." That's the kind of relationship that you want to have. So we had breakfast on that Friday morning, and I came home to find her still warm and dead on the kitchen floor that night. And I regret that she's not here, because she would have had a great time at a party like this. So now a little bit of context. The biggest positive change in my career over medicine has been women. And I think that's because Dr. Zook taught me, and the rest of the world sort of caught up, that maybe it was because of his surrounding himself with women, but he not only wanted them to be plastic surgeons, but leaders. And that's where, Roxy was that first big name, courageous leader for all of us. So that was important. I think women are better wired for men at multitasking. Women have a better, Deborah Tannen has all the stuff about where women are better collaborators and men are better focused hunters. And I think there's some truth to that. And whether you want to take it that they get blamed for this work-life balance question or whether they get credit for it. So this notion of work-life balance, I was in the ER, and when a guy had a chainsaw injury to his knee, I thought, that's plastic surgery? Really? Seems like that's orthopedics, because it's a joint and it's a hole in it. So I called Dr. Zook, and to Nicole's point about we were on for everything, we were on for everything. And we had this, the definition of plastic surgery was the skin and its contents. So I think life is kind of like that. We can simplify it. Life is just birth to death and the contents in between. Balance, when we talk about work-life balance and the decisions that we make, I think it's a bad vocabulary. Because balance is where you have two opposing forces. When you're on a teeter-totter, you balance when the weights, which are opposing each other, balance. I think the SIU approach is the better approach. It's integration, not compartmentalization. We'd be in the lounge having lunch, and Dr. Zook getting ready to go to Nicole's track meets was just as important as having the next patient ready. It was almost like they were of the same category because he had that integrated life. So at the end of our lives, we want to have success. We should figure out what success is. And I think success as a definition could be the accomplishment of an aim or a purpose. But what's not success? I think not success is an opportunity to learn and improve. And I don't think there is such a thing as failure. There's some things that you wish might have gone differently, but it's not really a failure. My second marriage was an absolute disaster, but from it came my daughter. And the genetics that made her would not have happened if I hadn't had that marriage. So I think when we look back, we should be very cautious to say, I have a regret about that, because blended into all those things were opportunities to get improvement. My wife and I used to joke when we would apologize, it was, don't be sorry, be different. And we have to be careful of our fear to change isn't always a justified fear. It's kind of the fear of the unknown. And we all know from taking care of patients do much better when you tell them bad news that's concrete than you do when you tell them bad news that's nebulous. So we'll try and, Bob Ruberg, my first fall, put a letter on my desk for a new job opportunity. I thought, well, this is great. I've been here 6 months, I'm getting fired. And it was an attitude change. His point was you should always be looking for a better job. And if you find it, take it. But if you don't find it, now you should be comfortable knowing that the current job you're in is the best job that you can have. So when we're making change, we have to accept the reality, and I think it's going to be true for you even worse than it was for us, the old folks, which is the rate of change is not slowing down. The change that I've seen in the 40 or 50 years that I've been doing this, the pace, to Elof's point, what business is doing to it, what economics is doing to it, what society is doing to it, the challenges that you have are greater, and the rate that they're changing is greater. There's this notion of burnout, and I think it would be an interesting but not detectable part to look at burnout based on your training program. Because my suspicion is that we don't have a lot of people who burn out. I suspect we have people who change and adapt and may even stop practicing, but not because they said the world is killing me, but because they're adapting to new circumstances. So satisfaction, how have you spent your time in your past? What are you doing now? And security is, how are you going to spend your time in the future? One of the ways to do that is develop a mission statement. And Dr. Zook lived that. His mission statement was to be the best you can be at everything you do. The implication in there is if you can't be good at it, don't do it. There's also some advice in that too. An MBA school sort of formalized it. If you can have an overriding principle that helps you make decisions, it gives you a yes, no, it gives you a way to consider it. So you don't have to have a, for the rest of your life, mission statement. You just need to be aware of what are your goals and what are you trying to get accomplished. So when my wife and I moved to Montana, we had a very simplistic mission statement. We wanted to live better. And as her health failed, we traded control for security. I had a notion of retirement being that I was going to work hard, retire, and then Diane and I were going to go play. And then it changed, so I was going to work hard and retire and then take care of her. And then it's like, I have a granddaughter. I discovered I love her dearly, and I do not want to be grandpa down the block. I like being grandpa in Montana and going down and spoiling them decadently for a week and then go back to the quiet of my home. So someday I'm going to stop, but for right now, I'm in the transition of changing from a full-time contract to a part-time contract. As Nicole points out, contracting gets trickier and trickier. So here's my welcome to come to Montana and hang out. This is the view from my deck. This is sunrises. It's a pretty place. When we were moving, people said, "You're going to move where?" I said, "If I'm going to go broke, I'm going to go broke in a pretty place." So a couple of things to kind of put in here. I think it's reasonable to steal traits that you see in other people that you admire. Dr. Zook, I would call him, and he always sounded like he was wide awake. And I do that, and the ER laughs at me and goes, "You were just waiting for my call?" And it's that little thing that you get to steal. Another pearl is do the right thing, not the convenient thing. We made rounds one Saturday. There was a patient had a tibial wound. Dr. Zook asked John what he was going to do. He said, "Well, he needs this, but I'm going to do that." Oh my goodness. I'm not sure I've seen Zook any more irritated with a resident than he was with John. Over-prepare. So one day during all my mental mix-up stuff, Bob will probably remember this, we were doing a latissimus, and I cut the vessel like up on the muscle. And he came in the room and looked at me with eyes, and he didn't have to say a word. I was just dead. But he just fixed it. We just put the vessel back together and went on with the free flap like nothing happened. So you can never be too smart or too technically good. And we always pride ourselves on how cool our technology is. But every once in a while, sometimes staying out of nature's way and letting the problem turn to a problem that's got an easier solution is better than trying to get complicated. We could sit and quibble about should you do this or should you do that for this guy's nose, and I didn't do anything to it. I just put dressings on it. And when it scabbed in and shrank down, I revised his little notch. So sometimes being good is much more about being wise than sort of going, I got miracle hands and I can fix this. Not that miracle hands are a bad thing. So be loyal. I was sued by a lady who was unhappy with her scars, and Dr. Zook, true to his word, came and put in our defense, and we won that case. Be the adult, don't get bullied, don't be a wimp. When we were going through all the divorce stuff, it was a good mantra to have, which is treat people with respect, and the people who learn from you will then emulate that. Dr. Zook taught me that the only thing more important to institutions than money is control. And so if you're going to work for an institution, you get better security, but you're giving up control. Ask yourself where your perspectives come from. Outliving your father at a young age makes you kind of feel like you're on borrowed time, which is a nice feeling. Being a part of the I Should Be Dead Club, I think Mike and Bob have both kind of been through this. And it gives you a different perspective on, that little book that says don't sweat the small stuff, and it's all small stuff. Once you try and die, it is pretty much all small stuff. And when you have a death of a spouse, being in your doctor head is not fully protective, but it's helpful. But it does mean that you're screwed up compared to the way the rest of society deals with death. It just comes with the territory. You want to talk to me on sidebars? I'd be glad to give you kind of any other philosophy pieces in there. Another Dr. Zook pearl was that a satisfied aesthetic patient is happy, but a satisfied trauma reconstructive patient is grateful. And happy people pay you, but grateful people make your heart warm. This kid, 6 years ago, went through his windshield, and we fixed him up. And then 2 weeks ago, when he was repairing my gutters, said, "You remember me?" I go, "No." He goes, "You're getting a 10% discount because my forehead looks pretty good." All of us in this room, by our association with SIU plastic surgery, have talent in one way or another. The talent is a mixed blessing. When you're talented, you have to choose what you're going to want to do. If you're average, the world chooses for you. So be grateful for your talent, but realize that you're stuck with it a little bit, that you're going to have to make more decisions than the average person. Think about all the different ways that you can get joy and don't diminish them, whether it's your work. Work is the easy one for us because we get gratified. But there's friends and family. There's all this list. Learning unnecessary stuff is really cool because as you slow down a little bit, when I ride my bike, I do it in the basement and I have my little screen and do mathematics lectures because it's weird. Don't be afraid to take joy from sadness and loss. Here's the joy, and I find it a little ironic, the things you take away from your training program. Apparently breast cakes was one of the things that I adopted, and people kind of follow through with that. Don't recreate, because recreate makes it sound like a job. Play. Do what 3-year-olds do. Make stuff up. Do things that you can't tell your mother about. Slides on the far bottom right. And then savor the sadness. When my wife died, it was weird. And so I have a tattoo of her urn because I could. For the longest time, I wanted a tattoo, but I didn't know what I wanted, where I wanted it to go, and it was permanent. But as you get older, permanent gets to be a shorter and shorter interval. And have a sense of humor. Dr. Zook was good at teaching us irony. And these are 2 slides that I found that I thought were interesting of the irony piece that I thought Dr. Zook might have enjoyed. I thought it was doubly ironic that the woman with the bathing suit up on the top that it has on Facebook says, "See more." I didn't click on it for fear that I might, but did I go away? Don't forget your support staff. They make your life reasonable. Sharon Zook, I tried every time that I did this embarrassing talk in front of the Zookies, I would always bring Sharon up because I know that while he was sitting waiting for my phone call, she was trying to sleep. My mother turned 90, and don't forget your family because it's how you became who you are. I don't think there's any career that has a legacy potential greater than plastic surgery. Yeah, there's politics and nature and war and economics, but the restoration and the modification that we do for people reaches into the future in a way that nothing else does. And education that happens here gets you the talents to be able to do that. So here's another little Zook pearl. I learned to sew the endotracheal tube to the tooth if you were doing face stuff, so that you had all the skin that you could move around and you didn't have to worry that anesthesia was going to freak out that their tube was going to come loose. It's in our DNA to be creative, and I will tell you that I've talked to plastic surgeons around the country in training programs, and there are we are good people in this room, but there's a lot of plastic surgeons that aren't necessarily good people. They may be good plastic surgeons. I had the privilege of being a board examiner and worked up to being a senior board examiner until I irritated one of the people who made the decisions about who got to be a senior board examiner, and then I wasn't anymore. So it's in our DNA in this room to be creative and talented. So Dr. Zook's little scribe on his picture to me was this, and I think it's true for us. We have the talent, we have the background, you're getting the background, you will have so many opportunities right away, but then opportunities 5 years later and 10 years later, don't be afraid to take them. So I would just finish by saying that, SIU has done well by me, and I think we go out and have an opportunity to take our heritage and utilize it. Thanks.
Thanks so much. I'm going to steal this guy from the front.
Yes.